Okay. All right, guys. So we're back with another live Q&A for No CD. My name's Casie, and we actually have one of our therapists with us today, Madina. So we're going to be answering some questions from the community. So as you're coming in, feel free to drop some questions. We will try to answer them. I'm not a clinician, but we do have one with us tonight. So we can get perspective from somebody who has OCD and somebody who treats OCD. So I think this is the first time I've gotten on and we actually don't have any questions yet, which is really crazy.
I know.
Hi, Haley. Nice to see you on. So I guess we can start out with maybe what kind of questions that you normally get whenever people are starting.
So I think a big thing that so many people come in with is wondering if it's actually OCD, and this kind of perpetual fear that maybe they're going crazy or their thoughts are true. So I think a big part of the beginning of treatment, which I'm sure you're familiar with too, is just normalizing a lot of these thoughts. I always remind people that part of the reason you're here is because you're judging thoughts that really all of us kind of have.
Yeah.
So that can be really big.
Yeah, that's true. And I try to tell people that too as they're going in. The really nice thing is you don't really need to have an exact idea of whether you have OCD or not, because we give you that diagnosis in the first session.
Mm-hmm.
And unfortunately, like you said, a lot of people don't really, OCD is not really well known in general society or perceived, right? So a lot of people unfortunately do come to us self-diagnosed. So it's normal for a lot of people not to have that diagnosis going into it and kind of asking, do I actually have OCD?
Mm-hmm. And in true, I know, do we have questions coming in? I don't know.
We
But
are
in true,
going in.
in true, this will be like the last thing I say, but in true OCD fashion, like almost like clockwork, the second session, when someone comes back after I diagnose them, their question is, what if I don't actually have OCD? And so that's become the new obsession. But it's the doubting disorder. So of course, doubts the diagnosis.
Yeah, I know that was something, and it's actually interesting talking to so many people now. I remember very vividly whenever I first started treatment thinking, what if I don't actually have OCD? What if I'm just being like in my typical self and worrying so much about different things and I'm wasting this person's time and just all these different things. So it was very relieving for me to have somebody be like, no, you are going through this and it's severe enough that you should be getting treatment. So I was like, okay, I have something to work off of. So we are getting a lot of hellos. So thank you guys for hopping on. Got a good amount of people finally, so which is great. So I think the first question that we could start off with is this one. Aurora says, hello, can you talk about derealization / depersonalization? Do you want to take this one off, Madina?
Sure. Yeah, I think a lot of times that presents itself as more like a somatic form, kind of like feeling out of body, as a lot of times how derealization is kind of defined. So a lot of times I'll see people just being over aware of their bodily sensations, and if even like that same kind of concept, if I'm going crazy, if I'm really experiencing what I think I'm experiencing. And so we do a lot of what we call interoceptive exposure. So we're just essentially re-evoking those bodily sensations, so you can learn, just like you're learning with your thoughts, that you can manage those uncomfortable sensations.
Mm-hmm. Yeah, I think that's something too that I guess, would you consider this similar to like disassociation?
I mean, I think in general, anxiety takes you out of the moment, right? It's so future oriented. So in a way, it is this kind of like you're not here, right? Because that's essentially what I think you're asking, is like this out of body, not present focused. So yeah, I would say it's pretty similar.
Yeah, I know that's something that I experienced a lot. And that's something that whenever I'm ruminating really bad, I get really sucked into that. And thankfully, it's something that as I've hit to this point of recovery, and I'm sure a lot of people watching this are going to recognize this too, that if I'm ruminating on something, I used to just disappear for like 45 minutes or something, just thinking and obsessing. And now I kind of am able to stop myself like 10, like not 10 minutes, like 2 minutes in, and be like, okay, I need to step back. I'm falling into that same cycle.
Hmm.
But
Yeah, like you're physically there, but mentally you're just somewhere else.
yeah, yes, absolutely. Um, oh, this is a good one. What do you do when your OCD makes you feel like others will judge you if they knew? Um, I think personally, and I think about this a lot too, that, it's not so much, I, I think part of it is those physical compulsions that we worry about if somebody would see us doing something, and also like if they knew our thoughts. And I feel like we've all been there where we have to kind of come up with an excuse for why we're doing what we're doing, that um, making, I guess, sense of this compulsion that we feel like we need to do, but we suddenly need to explain to somebody else why we're doing it. Um, I found that it's actually worse for me whenever I would try to make excuses for things. Because the people that I've opened up to about my OCD and I kind of explain to them what's happening and why it's happening, they're very compassionate and sometimes even are able to help me work through them. Um, and I think that's also something that's come with being able to explain it, because in the beginning, I really didn't know how to explain why I was doing these things or why I was thinking these things. So I kind of just shut down and was like, nothing, never mind, I'm not doing this. Um, so it's nice when you get to a point that you can start to explain it. And, most of the time, people are very understanding. They know that this isn't something that you want to be doing, and this isn't something that really says anything about you as a person. And especially if they're one of your loved ones or somebody that cares about you, they'll absolutely be able to help.
Hmm. Hmm. Yeah, and I think it can be really empowering to be able to let yourself get the support that you need, because I think, maybe closing up about that information is really anxiety driven. It fears how people might respond. And, we know that ERP, we're so badly trying to teach you guys how to live out of your values versus your fears. And also remembering that your thoughts don't now equate to like you as a person and your morals and your characteristics. They're just thoughts, versus them being attached to who you are. And I think with OCD, that can become kind of the MO.
Mm-hmm. Definitely. And if you see any certain questions that pop up to you, let me know and I can go on to them.
Okay.
Um, do you want to try for this question? Bella says, I have an OCD theme that people think I'm evil by seeing how my eye contact is. What should I do? It's so debilitating. I guess my first question is if you're working with a therapist, you're on the right website if you are. NoCD has a lot of really great therapists who are very, very expert on treating OCD. I know personally from experience that going from a talk therapist to somebody at NoCD, they are very knowledgeable about all the different ways that OCD presents and things that we might not really make sense of. So, that would be my first suggestion. But Madina, I don't know if you want to add to that.
Yeah, I could take a guess that maybe you're kind of over evaluating how people are looking at you. So that would kind of be the second line if you are starting to work with someone, because I definitely do agree with Casie that that's a great recommendation. But yeah, just making sure that you're not checking. There's probably a lot of checking behaviors going on with how people are maybe responding to you. And almost this, trying to think of the word, like mind reading kind of type of like cognitive distortion here going on, like assuming that people are seeing you in a particular way. And no matter how people are looking at you, I'm guessing you're still questioning if they think you're evil. And so that's where that inhibitory learning comes in. So we're really learning to accept that we may always think that and we may always feel that, but we can handle that. And making sure you're engaging in your interactions. I'm going to also guess that maybe you're not really present for these interactions and you're missing out on a lot of your life.
That's a really good point too. I think that whenever we're thinking so much about certain things, we're not really presently in the moment, and that might even take us away from a lot of those intrusive thoughts. Okay, this is a good one. Nina says, hello, do you think it's possible to completely get rid of OCD? I feel like it will be a part of my life no matter what, and it's scary to think that I will be in therapy forever. So I guess as somebody that has hit this point of recovery, I would say that, there is no magic cure or pill that we can take to just kind of get rid of our OCD forever, but you can get to a point where it's not affecting your everyday life. And I say that as, I didn't really know what recovery for OCD meant until I got there. And I look back now, and when I was going into treatment, I was extremely depressed because of my OCD. I was doubting all of my relationships with people, and I just felt extremely isolated. I felt like I couldn't make sense of all these little rules I was making for myself. So, after getting into therapy, figuring out how to manage them and get them under control and get to a point where, it's I can manage my OCD and it's not something that feels so out of control. It doesn't affect me nearly as bad as it did before. I think before I was in this place where I was either having all bad days, or if I was having a good day, I would have that backdoor anxiety of when's something going to trigger me next. So I wasn't really even having a good day.
Mm-hmm.
And now to a point where I have mostly good days, and maybe, once every 2 weeks or whenever it may be, something might upset me. And even then, it's not so scary because I know how to handle it.
Mm-hmm. Mm-hmm. Yeah, to Cassie's point, I've definitely seen OCD be very well managed, and yes, not impacting everyday life. And even just reframing what the diagnosis means, because I can totally validate the fear in that, like, oh my God, what does life look like now that I have this disorder? But I really, the more and more I work with OCD, I really realize how much you guys care, right? And I think that is part of the disorder. You guys are worrying about these things because they're your values. Unfortunately, OCD has skewed it a little bit to this idea of, oh my God, does it mean it's going to happen? Or what does that mean about me as a person? And so even just reframing your worries as, hey, these are things that are really important to me. And that's why I'm worrying about them, not necessarily because they're true.
That's true. And, on the flip side, it's kind of funny whenever I had one of my later check-ins with my therapist, and all of my scores were going down. I remember her saying, like, you're almost at a point where you wouldn't even come up as having OCD. And at first I was like, oh my God, this is amazing. And then I immediately panicked and I was like, OCD has become so much of my life. Who am I without it? And for me, like, I kind of had to laugh because that was my OCD definitely still being present.
Yeah, it's
Um,
never satisfied. Like you finally start to feel better, and I see this all the time. It's, oh my God, why do I not feel anxious? Or kind of what you said earlier, like when's the shoe gonna drop again? And the shoe will always drop, because that is life, right? It ebbs and flows.
Yeah, exactly. And it's kind of funny too now. I always wondered if OCD was always going to be something present in my life. And now it's not present in the sense that it was so distressing to me, but now I work in a place where I talk about it every day. And for anyone wondering if that's going to trigger you all the time, some days it might, but for the most part, it's something that I've been able to turn into something positive in my life. So, you know,
Mm-hmm.
you never know where life will take these things, I guess.
It's almost like exposure every day.
It really is. It really is. But it's good to know that some things really don't bother me anymore. So it's definitely hopeful. Let me find another good one. Mm, okay. It was helpful to be diagnosed, but after being diagnosed, I've been latching onto other themes like germs, and I feel tortured by thoughts and then get upset about being diagnosed. Any advice? This is an interesting one because I never was really, as I said, it was kind of relieving for me to get that diagnosis because I was able to kind of start to make sense of all these suspicions I had. especially coming from somebody who I was always called a hypochondriac and I was always worrying too much about things. So it was really relieving for me. But I know I've heard a lot of people talk about this, so about getting upset um, about receiving a diagnosis. I guess what advice would you have for, because I know you see new people all the time that probably do get upset about that.
Yeah, I would say it's probably hit or miss, kind of, half would report what you're reporting and then the other half might report what Allie is reporting. I guess the word that stands out to me here is upset. And I wonder if the feeling of being upset is what's perpetuating some of these fears, and maybe feeding into some rumination. We know that we want to learn to accept some of these feelings that aren't so comfortable versus maybe trying to figure out why you're upset. I don't know if any of that is going on. And I think if you really look at anything in life, there's a little bit of good and a little bit of bad in pretty much everything. And that's kind of what you're saying, right? It was really helpful to be diagnosed, but also it comes along with these things that feel scary. And they feel scary because you're probably about to venture onto a journey of change. And that is a scary thing for anyone. So I think just really normalizing, validating that it's upsetting, it's a transition, it's an adjustment.
Absolutely. And the nice thing too, I try to mention is that it's upsetting now, but the fact that you're getting a proper diagnosis means that you're now in a place where you can start to get help, which
Mm-hmm.
at the end of the day is very important.
Mm-hmm.
I just realized my battery is dying, so I'm gonna put up a question that I think might be a good one for a therapist anyways, and I will be back with my charger.
Okay. All right. So Amir says, I'm getting tripped up with the intrusive feelings. How real can OCD feel? Because it's gotten to the point where it feels like I genuinely enjoy the thoughts, and that scares me. So of course it feels real. If OCD did not feel real, it would not be a diagnosable condition. It has to feel real. So I think that's the first piece of this. And it sounds like you're doing a lot of checking of your feelings and evaluating how you should or shouldn't feel in accordance with your thoughts, right? So the way you feel in response to a particular thought doesn't have to mean anything. So I think that's the other piece of this is you want to make sure that there's no meaning that's being assigned to these thoughts. Enjoying a thought doesn't have to necessarily mean anything. You can enjoy lots of thoughts, but it doesn't now equate to action. And I don't know if you have anything to add, Casie, or.
Yeah, and I think too, it's hard whenever we have those, I guess, more taboo themes, where it's like the harm OCD or POCD. It's really hard whenever we start to question, what if I enjoy these thoughts, or, even when people get groinal response. I think something that helped me is I actually brought this up to my therapist one time during a check-in because I was having a lot of conversations with somebody with POCD, and I remember having a very vivid bad dream where something like that happened. And I had that fear, like, oh my gosh, what if I dreamt about this because that's what I wanted? And it was so, even though I knew what was going on and it wasn't me, it was this very sickening feeling.
Mm-hmm.
And she raised a really good point to me is, there's a huge difference between people who think these things or a thought passes through their mind and people who act on things like that. So,
Mm-hmm.
even the fact that having that thought pass through our mind is like upsetting and distressing for us, people who are really like that or people who do hurt people don't get really distressed by those thoughts. And
Mm-hmm.
that was something that really stuck out to me that kind of made me feel like, okay, I think I can actually go into doing ERP and, knowing at the end of the day, this is my OCD and I'm going to be able to work through it.
Mm-hmm. And do you mind if I add something to that? Because I think of terms of like evolutionarily how the brain is wired. So we want to remember that it's wired to notice the negative things. So you think of caveman times, you have to notice the lion. You don't necessarily have to notice the flower, right? That's not going to kill you. And so what the brain is doing nowadays is it's alerting us of situations that could potentially be dangerous, and not even necessarily in a physical way. And so even just thinking in the brain, because really what the brain is doing is it's just trying to warn you of something that could happen. And again, it's usually something that would be out of accordance with your values. And so again, kind of looking at OCD a little bit differently versus I understand getting angry and frustrated with it, but also like thinking it in a way like, thank you so much for warning me for like this fear or this scary thing that could happen. However, I'm choosing not to go down that path. So hopefully that is helpful too.
That's a really good point. I've actually never heard someone use that comparison, but I really like that because we do notice the negative things often before the positive ones. So that makes a lot of sense. Okay, this is a good one. When you hit an anxiety spike, do you recommend telling someone you're experiencing anxiety without the content, or just try and accept it and let it pass? Oh, go ahead.
Well, so I was just going to say, depending on the content, might be what you were going to say too, Casie. I know with some of the more taboo themes, it can be a bit more difficult, like POCD, if you're a teacher, right, that might not be something that you would want to necessarily tell the content to, especially if someone's doesn't understand OCD. And so, or even in relationship OCD, I think this is a good example. I wouldn't recommend telling your partner, hey, I'm having a lot of doubts and thoughts about, if I really, really like you or if I think you're attractive today or not, right? But more so like, yeah, I'm having an anxious day, and having that kind of be the communication. So I guess I would say it depends on the content.
Yeah, I would agree. And I think I try to mention this too whenever people ask about opening up to people about their anxiety, or if they're having or about their OCD, excuse me, or if they're having an anxious day because of their anxiety, or they're working through an intrusive thought. The thing that I noticed whenever I first started opening up to people about it is, the really nice thing is we don't have to totally open up down to every detail with people. I know that personally, there were people that I just told I had OCD. There were some people that I told about the subtypes and talked about what they were. And then there was select very few people that I shared some of my intrusive thoughts with. And it's nice that you can do that in stages. You can share with people a little bit about what you're going through or in more detail. But like Madina said, I think it's definitely situational and how much content you feel comfortable sharing. Ooh, this is a good one. Is virtual treatment just as effective as in person? What are your thoughts on this since you're a virtual therapist?
I am smiling because I think if anything, it's more effective, specifically with OCD. So I get a very kind of private view into so many of your guys' lives, and can walk you through exposures. So anyone who's not familiar with ERP, it's a lot of behavioral tactics that we're using. So literally doing things in the home can be really effective for exposing people.
Yeah, I feel the same way. I have people ask me this a lot, and I'm like, if anything, I think it's more effective because if you have a certain place in your home or in your surroundings that trigger you, or that, is something that you need to work on, you can literally take your therapist in your hand or on your computer and do that thing with them. And that was something that I was able to do in treatment, which was really, really cool. Um, and that's a lot of those things you just can't do in an office setting. So I think if anything, it opens a lot more possibilities. Okay, we have one about real event OCD. Why don't we touch on that one? My real event OCD is actually based on something I did 20 years ago. My fear is what would people think of me? This one, I don't know. Do you want to start with this one?
Sure. Yeah. This is definitely not uncommon. I'll see this pretty often. The first thing that I want to address is my fear of what people would think of me. we would never know what people think of you. So I think that's something to kind of demystify a little bit here. OCD is probably very convincing in telling you need to ruminate and maybe ask people to tell you how they feel about you, all of which isn't going to get you to the bottom of that answer. You may always wonder that. And I would go as far to say, I think we all, to a certain degree, wonder what people think of us. We want to make good impressions. So normalizing it for that piece of it. And then as far as essentially punishing yourself for something that you did 20 years ago, I think just even thinking of that out loud, like, is that really how your values would want you to live? Would you want to, actually, I'll reframe it this way. Would you ever suggest anyone else punish themselves for something that they did 20 years ago? I think everyone watching, you and I, Casie, both, we've maybe done something that wasn't the best decision. And so now, team Martin, are you suggesting that we all punish ourselves for something that we did years and years ago? Or would you suggest that we recognize maybe that wasn't a good decision and move on with our life and try to behave in a way that maybe that situation wouldn't come up again as best as you can?
Yeah, I completely agree with that. And I think even, we all think those things sometimes. And I think what's nice about this is it's a really great place to practice accepting uncertainty. Like you talked about, we may or may not know what people would think about us, but we can accept that, this might not make a difference, or, somebody 20 years ago might still remember this, or they might not at all, but, you can accept not ever knowing that. And not knowing is definitely a scary thing, but it's something that, we definitely have to learn with this disorder. All right. How does ERP work with a girl who has sexual orientation and is bisexual and dating a woman? I want to first say I very much appreciate you saying sexual orientation OCD. I'm really pushing for people to get away from HOCD. Just because
I know I confuse it with harm OCD.
I confuse it with harm OCD very bad too, but I also, for anyone that doesn't know, it's homosexual OCD. And, I actually heard on OCD Stories podcast how not only is it outdated and it kind of has like a negative connotation to it, but also it can, people who are gay can have intrusive thoughts about being straight, and people who are, can have intrusive thoughts about being asexual, or, there's so many different things that HOCD, oh my gosh, it really narrows it down to one thing that's just, it includes so much more than that. So sexual orientation OCD is a lot more accurate for that. But I will get off my soapbox now. It makes me happy that people are gravitating towards that.
I agree.
So as far as how ERP would work, I try not to give ideas for ERP because I know it's going to be different for everybody based on your history and going into more detail with a therapist. But I don't know. Do you have any, I guess, just broad ideas for something like this, without the specifics?
Yeah, typically with this subtype, I'll see a lot of, again, checking behavior. So checking how you feel around your partner. Like notoriously, it's how, if I don't feel excited, right, to be around my partner, does that maybe mean that I should be with a man? I don't know. I'm just making an assumption here based off the question or whatever the question, the what if. So I would really resist not having feelings, but checking your feelings and assigning, again, meaning to them. So we have to remember that in relationships, we are going to show up in our relationships in many different moods and feelings and thoughts. And a good way to kind of maybe give you an example, you can think of probably any other relationship in your life other than the one that you're worrying about. You've probably shown up and felt many different ways in that relationship and maybe never questioned it. So it's a clear example that you're able to accept uncertainty, but OCD is convincing you that in this particular area you can't. So I think just checking feelings would be a big thing, and just ruminating is probably across the board with all OCD. So making sure you're not going down the rabbit hole with Do I like men? Do I like women? Am I with the right person? Am I with the wrong person? Do I love them? Maybe. The best way to find out is to engage in your relationship or engage in the dates that you're going on.
Yeah, I think that's a really good point. I try to, whenever I get intrusive thoughts about my relationship, I try to just tell myself, am I enjoying this moment? And the answer is usually yes. So it doesn't do any good to continue, like you said, continue checking and checking. Is this person right for me? Am I happy? Different things like that. And as far as the sexual orientation part goes, I think we're all very lucky that we live in a day and age now where it's really acceptable amongst everyone, and for the most part. Um, so it's okay to have that question, and it's okay that we might not always know the answer right away. Like I said, we live in a world now where we're okay to explore that and figure out without, ruminating on it for so long. I like Carl is on here. Hi, Carl. He said, everything is normal. If you're doing it, a human does it. The right question isn't if it's normal or not, but rather if you're finding it disruptive to your quality of life. It's a very
Yeah,
good
I love
point.
that.
I
Yeah,
love, oh, sorry, go
no,
ahead.
you go.
I was just gonna say, I love whenever people ask if something is normal whenever they go into treatment. Do other people do this? Is this normal for OCD or not normal? And it kind of makes me smile because I used to do that all the time. Whenever I was just kind of coming to terms that I had OCD, I would go on the app and ask people, I do this, this, and this. Is this normal for OCD? Is this
Mhm,
something that a lot of other people do? And I've learned so much that nothing is normal or abnormal. It's
mhm,
just, I kind of think of it as if somebody's experiencing it, chances are somebody else is too. And, we don't really have control over what our OCD latches onto. It's just kind of the way that the disorder cycles through and how it works.
mhm, mhm. Yeah, it's a form of reassurance. So I
Yeah,
love that he said that.
it really is. I didn't realize it until I started getting into treatment, but I was like the reassurance queen. And you know, the nice thing is eventually being able to open up to people and talk about it. But then also the bad thing is they can no longer give me reassurance because
Mhm,
everyone knows what it is and they know that they can't give it to me.
mhm.
so, so yeah. Um, Let me look through and see if we have any more. And if there's something that you um, see, then we can definitely.
Um, oh gosh, I think mine jumped to the bottom.
That's what mine did too.
How
What
about
about?
you
Oh,
go?
go ahead. Go ahead.
Um, I kind of want to do this one because I feel like this is a common struggle, unfortunately.
Mhm.
So why is ERP so expensive? I did 4 sessions and then lost my job because of OCD. I couldn't afford it anymore. How much is no CD in Texas with no insurance? So the last question, I would encourage you to visit our website and call and figure out what the cost would be because we would not know off the top of our heads, unfortunately. But yes, ERP can be very expensive and it's hard to find providers. And that's actually part of our mission at No CD is to be able to make ERP more accessible and affordable overall. So I would definitely call No CD and check in. And then the other thing is certainly expensive and hard, I think, is the other thing that a lot of times prevents people from wanting to come. And I always like to reframe it. How much time and I want to put monetary value on time. I think it does deserve that like duality. I don't know if that's the right word I'm using, but I think it is worth the money, right? Because how much time and memories and just stress has OCD taken from you? And really kind of thinking of it in terms of that might be helpful too, although expensive for sure.
Yeah, and I will say, compared to other places, I mean, definitely not me putting this out there because I work there, but also as somebody that has OCD and I've looked at other places in the past trying to get help. Talk therapy is cheaper, but you're not going to get that same level of expertise. OCD is definitely something that's very unique, and I think needs somebody trained in ERP, because it's very different than just anxiety or, being upset about something. And on the flip side too, it's, we are very much cheaper than a lot of OCD specialists that I've seen personally.
Mm-hmm.
And especially coming from somebody who grew up in a very rural area, there was nowhere nearby that I could have worked with a specialist. So that's also another benefit to trying out something like this that's virtual. But we are working to get as many insurances as possible. We're still a fairly new-ish company. We're definitely more established now, but unfortunately, a lot of insurances just don't cover mental health like they should. But we're working so hard to partner with as many as we can and help them recognize that OCD is something that healthcare should absolutely be covering. So stay patient with us as we try.
Mm-hmm.
See if we have any other good ones. Oh, how about this one? Have you heard of a backdoor spike?
Yeah. So I kind of would define it as maybe initially the fear, the obsession, maybe being able to respond to it effectively if you are doing ERP, and then maybe later in the day feeling that backdoor spike, the anxiety coming back. I think my biggest thing that I see here is this is a person's way of trying to delay their compulsion or not do their compulsion. Especially in the beginning stages of treatment, if you're delaying your compulsion but not giving a time limit to it, I will often see people backdoor spike much more frequently. And so if you are going to delay, I would literally put a timer on for it. In an hour, I am going to either decide, hey, I'm going to go ahead and do my compulsion, or maybe at that hour you decide that you don't want to.
That's a really good point. Yeah, that's all I would really say too. This one. Is mind reading a purely OCD thing? I struggle with knowing whether or not I am correct in thinking I know what the other person thinks or feels, or whether I am negatively thinking and quote unquote knowing. I don't know. I would say that probably people who don't have OCD also do this. Like, many other things that sometimes we might get intrusive thoughts about, and we just do it to a point that is distressing, and we kind of get stuck on it. But yeah, I don't know. What would you say to this?
Yeah, I think this question is kind of asking, is it normal that I'm doing this, as we were just kind of talking about? And in a way, I do want to normalize this, because I think recognizing that we all have a tendency to do some of these thinking errors, because that's essentially what mind reading is. And I think that can help, because for me, I think the last piece of therapy that can be a little stickier for a lot of people is recognizing the goal is not perfection. Not saying like, go ahead and freely like do all the compulsions, but there is going, especially if you are diagnosed with OCD, there is going to be compulsive type behavior, right? So you might mind read from time to time. And I don't want to necessarily label it as an OCD thing. And I would even go as far to maybe encourage you not to figure out what mind reading is and where it comes from, because we may never know. We just know that you're doing it. And we know that maybe we should navigate those situations a little bit different. Because I don't know if you experience this, Casie, but I think there's a lot of wanting to figure out why particular things are going on for you. And that almost sending into like a whole nother set of obsessions and compulsions.
Yeah, I don't think this is something that I've ever personally struggled with, but I think it's also, I also try to always remind myself that we don't really know what the other person's thinking until they say it. And I feel like for all my life, I've always tried to be an active listener. So I think I, not to say that people who have that, mind reading thing aren't aren't active listeners, but I always just try to think about what, I don't know what the other person's going to say. I don't know what they're thinking. So, it's all about accepting that uncertainty, I guess.
Mm-hmm. Well, I think you bring up a good point there. And yes, I don't think we're trying to say like that you're not being an active listener, but OCD does get in the way of you being able to truly pay attention. So yeah, maybe even like feeling a little bit zoned out or there, I can't remember exactly what the question said, but feeling like they're not understanding you or whatever, but you are kind of zoned out, right? Because you're worrying about if they are understanding you, which is kind of hard to then interact it's the self-fulfilling prophecy that so much OCD winds up becoming.
Mm-hmm. Exactly. Let me for.
What about this? Can I click on one?
Mm-hmm.
I think that this is a really common question.
Ooh, yeah.
How do you know if it's ROCD or an actual problem in a relationship? Did you have something you wanted to start with?
I think something that somebody actually also with OCD told me one time, because I was having something similar, is something that I try to look for whenever I'm having this is looking for that sense of urgency. Like, I need to figure this out right now or else something bad's going to happen. Whereas, if there's an actual problem in a relationship, we kind of look at it as like, okay, I need to figure this out. I need to, maybe talk to some other people about it, try to talk with my partner, different things like that. Whereas with OCD, it's kind of like, we're seeking reassurance. We are Googling things. We are trying to mentally check and make sense of something. And it's like that sense of urgency, like, I need to find this out right now or else, X, Y, and Z.
Mm-hmm, mm-hmm. Yeah, I love that you said that. I think that that's probably one of the number one things I tell people to remember is that sense of urgency with whatever subtype it is, because that can be a good indicator that OCD is running the show. And this is not to say for every case, but typically the difference between ROCD and relationship problems is in relationship problems, there's actually relationship problems. And in ROCD, a lot of times people will report the relationship, generally speaking, is good. But they worry that, maybe they're not attracted to that person or what have you. But everyone take that with a grain of salt, because I know that some people, what if it's actual relationship problems? How do I know that? So taking, again, that with a grain of salt. And I think just, again, remembering that all relationships are going to present with their own challenges and looking at the net worth of the relationship. That's probably not the best way to describe it, but overall how the relationship is. Versus with OCD, I think there can be a habit of looking at every moment and every time and evaluating what every moment means or doesn't mean versus overall what the relationship looks like.
I agree. Sorry, I'm having so many light issues right now. This is the only bad part about doing this in the evening.
I
We lose
know.
that natural light. Okay. So what else that we have? I guess I'm kind of interested about this one. So I would ask this person to elaborate, unless you know what they mean. What to say to people who accuse non-OCD questions as OCD questions. I'm not quite sure what they're talking about. If you do, if not, I would ask this person to maybe elaborate later on.
Yeah, I don't know.
Because I like to advocate as much as possible for things. So if it's a question that I could help with, I would definitely like to, but I would need a little bit more explanation.
Mm-hmm.
Okay, let me answer this one. What response strategy worked best for you? Did you do a lot of in-person or at-home exposures? And did the maybe response? So a lot of mine were, I guess, at-home exposures or in person. I guess that's kind of the same thing for me. So I the maybe one helped me a lot. I noticed that sometimes if I tried to agree with my OCD, it didn't work as much as the maybe for me, because I think the uncertainty was what was bothering me the most, that like I may never know this. Um, and that's what really I think stuck home with me rather than agreeing. And this is personal, ERP works different for everybody, different techniques. And that's one of the great things about it is there's so many different ways to do it and to tailor it to the individual. Um, and I use a lot of different techniques. I would um, try to write out uncertainty scripts, write out really in detail what my OCD was saying. I would try to do physical exposures, things that would trigger my OCD. And the nice thing about doing them, as we said before, virtually, is you really can get in a place where you know that you're going to be triggered. If there's certain rooms that have things that trigger you, if, you know, there's certain objects in the house that you can use, there's really so many different ways that you can do it. But yeah, my best response strategy that I used was definitely maybe this is true, maybe this isn't. I can accept that I may never know this. And I've found that universally, that is something that I think applies to a lot of my intrusive thoughts. And, but some people do agree. Some people I know agree and even elaborate more onto the obsessive thought to a point where it just sounds ridiculous to them, which I think is, really cool. I would love to be able to do that someday. So, it really is what works for you. But I don't know if you wanted to add on top of that, Madina, if you know of any good response strategies.
Well, I see everything as OCD, so I don't know if this question is a little bit of what's the best way I can do ERP. And I think such a good reminder is there's no one right way to do it. And kind of what you were saying, Casie, you just switch it up as much as possible. So, Allie, I would just suggest that try as many different response prevention strategies as you can, and always switch it up because we know that anything can become a compulsion.
Yeah, exactly. Exactly. Let's find more. Mm, Trying to read through questions. Okay. Oh, here's one for you. Medina, what about obsessing about compulsions, questioning if you should do normal behaviors like washing hands one time at the bathroom, or if they are compulsions? Do you see obsessing about compulsions?
Yes. So I usually see this a little bit deeper in treatment when the member really wants to be able to do the ERP so right, which I can love and appreciate, but there's just a better way we can go about doing that. And so I will remind members, if you do catch yourself doing a compulsion, the last thing I want you to do is to now obsess or beat yourself up over it. Just remember that, hey, that wasn't the best way to navigate, and I want to make a point to apply my ERP next time. Um, Again, that's not me saying go ahead and do your compulsions, but again, the goal is not perfection. So yes, let's not obsess over compulsions. And I think I also see a lot of worrying about worrying, which I laugh. And usually my member laughs with me, and not in a patronizing way, but we're worrying about worrying. Well, like, let's look at that for a second. So obsessing over compulsions is kind of perpetuating that cycle.
Yeah, exactly. I think that's a really good way to put it. And I think as I was going through a lot of this, I wasn't so much obsessing about normal behaviors, but I was obsessing about doing my exposures versus my compulsions and what I was doing right or wrong. And completely what you said, it does not need to be perfect. If you're doing an exposure and you only were able to do it for 5 minutes instead of the 7 minutes that you planned, that's still progress. And
Mhm.
there were some times where I did an exposure and then immediately after I did a compulsion and I was like, no, I just completely zeroed it out. But it's still practice. It's not ideal, but it's still practicing for where you want to be.
Mm-hmm. And just because I just noticed with her question, she asked about one time washing her hands after the bathroom. So if contamination is what you're struggling with, I want you to remember that the goal is not that you never wash your hands. We just want to wash our hands a reasonable amount of times. So I think too, if you are working with a therapist, maybe bouncing some of those ideas off, because I know with OCD it can kind of be hard to understand what would be a normal, whatever we want to call that, amount of times to do something.
Yeah, I think that's a really good point. What about this one? Why do OCD flare-ups during the day shorten when you've been in recovery for some time? Is it the brain's function of shifting learning to work better? I've seen a lot of questions throughout about OCD flare-ups. So some of them are about relapsing, and some of them are about this one about flare-ups being shorter. So maybe we can cover both at the same time.
Mm-hmm.
As far as this one goes, OCD flare-ups, I think the biggest thing is we know how to cope with it better when we're in recovery. Um, I know personally, like I said earlier, if I started ruminating about something, and I would normally do it for, in the past 45 minutes, 2 hours, whatever it is, um, I've gotten better at recognizing that it's my OCD and not actually one of my thoughts. So I can kind of take a step back and move on from that and say, I'm not going to keep worrying about this when there isn't really an answer that doesn't mean anything. So in that sense, if I had something flare up, it would shorten. Um, and I think it could also be, as that person said, shifting to recognize these things and better tackle it.
Mm-hmm. Mm-hmm. Yeah, I mean, I think you're definitely rewiring the brain. I like to think of the brain kind of as like a thermostat. So it technically doesn't want to be anxious. It wants to come back to homeostasis. Unfortunately, when someone has OCD, what the brain becomes reliant on to come back to homeostasis is that compulsion. So each time you do the compulsion, you get that positive reinforcement that you're going to feel better, versus relying on that natural process that happens in the brain. And so when you're doing exposures, you're choosing not to do the compulsions, and then you're reteaching yourself that your brain will naturally come back. As we know, nothing lasts for forever. And then the other thing, if any of my members are watching, they're probably not surprised by this because I'm very challenging. But that first statement, why does OCD flare up? And it's shorter, essentially, is what you're asking. Well, gosh, like, let's just enjoy that it's shorter. Let's not try to necessarily figure out why. Like, let's let ourselves have that shorter flare up and move on with our day. Overall, obviously, like, a good question, but maybe not even trying to figure out why you're feeling better, essentially, and just letting yourself enjoy it.
Mm-hmm. Yeah, I do like that. And then on the flip side, I have seen this question too. Why do so many people relapse after counseling? As far as the second part of the question, I think that's something that, at least I know clinically I can't answer that, but I think that's something probably would be a personal choice to you. But I don't know, what are your thoughts about relapsing later on? Because we know that recovery is never linear, so it definitely could happen.
Yeah, we know that OCD waxes and wanes, meaning sometimes it feels worse and sometimes it feels better. So that would be a big reason, I would guess, that I wouldn't even say you're relapsing after counseling. I just wonder if you're just relapsing by nature of the disorder. Um, Also, falling off ERP practice is a lot of times what I'll see with people's symptoms. Increasing stressors. So if something else maybe outside of OCD is going on in a person's life, their OCD likes to flare up in those moments. So those could all be reasons. I don't know, do you want me to touch on the psych hospital one? But I know most
Yeah,
hospitals.
absolutely.
So typically a couple of things that would indicate probably a psych hospital stay would be, or an inpatient is kind of how I'd like to call it. If there's like suicidality or like lethal, and when I say that, I mean with actual intent, not just a thought. Any sort of, like, sometimes eating disorders can be comorbid with OCD. If your symptoms are consuming, I would say probably like 5 or more hours of your day, well, not inpatient, that might be more like intensive outpatient. But if it's consuming like your entire day, you can't work, you can't really function in your relationships, probably pretty good indicators that maybe a higher level of care is needed.
Yeah. And I would say too, as far as preventing things like relapsing, I think there's some things that you should be mindful of. And exactly like what Madina pointed out, stressors, changes in environment, those can all be something that um, could trigger your OCD to come out worse. I know mine came out really, really bad around the same time that I moved away for college. And it was a completely new environment. There were so many new stressors. So it kind of makes sense that that's when mine would like all of a sudden flare up really bad. Um, and practicing ERP and, the different things you learn, I don't practice ERP as much as when I was intensively in OCD therapy, but I still like to, keep a notebook of the things that I've learned about managing my OCD and very often reflecting on that and trying to practice my response prevention messages. If I have something new flare up, I will immediately be like, okay, what's an ERP I can do for this? And practice it for like a good week or two. But yeah, definitely, it's going to be something that comes and goes. And, hopefully it's not as intense as what it was before, but I definitely think it's something to still um, always be refreshed on, I guess.
Mm-hmm. Yeah, and I think too that, this is kind of coming to mind after you spoke a little bit is, you feel so much better a lot of times after therapy. And so you're kind of riding this high. I hear a lot of times, Madina, I don't want to practice my ERP. I'm in such a good mood. I don't want my mood to be ruined. And I will challenge and say, well, you were in a horrible mood before you met me. So I don't think it's ERP that's doing it. Because I think it will suck you in because OCD wants to be on top. It wants to convince you that you don't need to practice. So I just encourage you to continue to practice ERP even when you are feeling good.
Yeah, exactly. And I feel like I've heard this from a lot of people say, ERP has never really made somebody feel worse or their OCD get worse. Um, if anything, a lot of times, like you said, we're already getting exposed and triggered all the time. And even if it's not happening at that moment, it most likely will happen again. So it's better to at least be prepared, have a good response message ready, I guess, different things like that.
Mm-hmm. Yeah.
All right, we have a few more minutes on here. I try to stop right on the hour because I know myself. If I don't, I will continue going and going. And I'm sure you don't want to do that. As fun as this is. So I guess if there's any couple that stuck out to you that you wanted to get to.
Um,
There's one on existential OCD that I see might be a good one.
I don't see it. Do you see it? If you want to click on it. Oh.
Have you or anyone you know dealt with existential OCD? It feels so much bigger and scarier than themes I've had before. I don't personally think I have existential OCD, but definitely I I don't know. It could be something that's not one of my main themes because things like I always think about, what's beyond space and things that we don't know or what happens in the afterlife or, you know, I don't know if I can take my loved ones with me when I like what happens, all that stuff. And it's definitely something I really don't like to think about, but I know probably a lot of people don't either. Um, but I can definitely understand how scary that would be because that's a very big uncertainty one for sure. And it's something that we really don't have the answer to.
Mm-hmm.
Um, but I don't know. I'm sure you've had members come through that have had that. But is there any common, I guess, common things that you would tell them whenever they do?
Well, I think, a lot of them will also come with that. It feels so much bigger and scarier than the other themes. And I think pretty much any theme will come in telling you that, like, oh, Madina, I wish I would have this theme or whatever it may be, because that particular theme feels so real for that person. So again, I think just validating for yourself how scary it feels, but also recognizing that just because something is scary doesn't mean that it's something that we have to do. There's not any behavior we need to do to get rid of that fear necessarily, because we can handle that fear. So I think that's the first thing. And then just with existential OCD, I think a lot of times what I'll see is a lot of harm OCD is actually intertwined with that. Like, what is life? What if I want to kill myself type of deal? Because, like, what is this all? Like, what's the point type of mentality? So I think working around, so many of our recommendations, working with a therapist so you can get a specific plan, and making sure you're tackling some of those fears.
Yeah. At the end of the day, working with somebody who's a specialist is going to be the best bet, because I can speak from experience. Obviously, OCD is a lot harder to deal with on your own, and it helps to have somebody that understands and has a lot of experience with this and is going to be able to give you proper coping mechanisms, which is, hard for a lot of us to manage on our own. But, well, we are at the hour mark, so I guess, is there anything you wanted to add before we wrap up?
No, thanks for having me join.
Of course, yeah. So thank you guys for tuning in. I think tomorrow night's going to be Dr. McGrath, and he always has a lot of really great insight as well. So, once again, thank you for tuning in. If you're currently working on ERP, keep going. You are doing great, even if it feels like it's a struggle. Anything you're doing to work on your OCD and get better is a step in the right direction, even if you don't feel like you're there yet. But yeah, I will talk to you guys soon, but have a good night.
Bye.